Hello, today we are talking about partial knee replacements. What is a partial knee replacement, who is suitable for it, and what are the benefits? As we all know, knee replacement surgeries are extremely common, and these are some of the most successful surgeries that we do. The knee has different compartments. You have the inside, the medial, you have the outside, the lateral, and the one behind the kneecap, the patellofemoral. In most people, it is the inside of the knee that gives way, what is called as a medial compartmental. And usually when this gets way, you get pain typically on the inside of the knee, you have difficulty in squatting and getting up, and you may have difficulty with stairs. If you routinely carry out physical activities, you may find that you struggle to do that for long periods. You may have some pain, swelling, difficulty in rising up after sitting for some time. How do we diagnose it? A simple X-ray tells us which part of the knee is involved. About 40% of my patients, when they initially seek help from us, it is mainly the inside, the unicompartmental or the medial compartmental that causes a pain. How do we treat it? In people who have initial symptoms, we give them anti-inflammatory medicines, we give them joint supplements, and we tend to give them simple injections. In younger people, we now use highly concentrated plasma, what is called as ACP max, and this is your platelets concentrated to 12 times. In older people, we may also give hyaluronic acid, what is called as viscosupplementation. However, when the joint breaks down completely and you have no joint space, we are then forced to perform a surgery. The different options in surgeries would include a unicompartmental or partial knee replacement and a total knee replacement. The benefit of replacing only one part of the knee with a partial knee replacement is that you leave your ligaments, cartilage, and the other part of the knee intact. This gives you a more normal feel and makes you return to activity levels better. And that's where this comes into play. You can even get back to playing sport with a partial knee replacement. George Bush had both partial knee replacements. 40% of our patients are suitable for this. And the benefit is it also removes less bone. Today, some of the partial knee replacements that we do, especially the Oxford partial knee, has a very long history, and the success rate of this is almost equal to a total knee replacement. Sometimes we can do partial knee replacements robotically as well. Partial knee replacements done well restore function, they make the patient highly active and make your knee feel more normal. So routine activities like stairs, playing some sport, all these are easily possible. Partial knee replacements additionally, if done in younger people, may wear out early, much the same as a total knee. But when we revise a partial knee toward revision, all it requires is to remove the partial knee and convert it to a total knee. So it's a operation that restores your mobility, makes your knee feel better, as well as removes less bone. It's a great option for those who seek help in time and early.